morning, I'm Laura Pinzon, and today I'm going to talk about gels derived from small intestinal submucosa as an injectable material for myocardial impact repair. These are the topics that we're going to talk about today, and first I'm going to do an introduction. As you might know, heart failure is a significant cause of mortality in the world. This is one of the most common diseases in the world. Maybe you know someone who has suffered a heart attack. Probably because here in Colombia, every year, 54,000 people die from cardiovascular diseases, and in the world, around 17.5 million people. That means that 2 people are dying every second. This is the myocardial infarction, and it's caused usually because the coronary arteries are blocked. That means that the oxygenated blood can reach the left ventricle. It looks like this. Okay. When the heart attack doesn't cause death, the body starts to remodeling the tissue, especially on the left ventricle. And this means that this ventricle loses their ability to contract and shortening. And it also, there is an abrupt increase of the loading conditions in the heart. As you might know, constantly blood is being pumped to the heart, especially on the left ventricle, because there is the place when the oxygenated blood from the lungs. Okay, the body can never fully repair the heart, and there are being developed therapies for these problems. The idea is to prevent the progression of this disease. Actually, there are a lot of biomaterials that has been developed, but unfortunately, not all of them have the necessary characteristics. They are risky and they have limited recovery effects. An effective solution should have characteristics like biocompatibility. That means that the body have to accept the biomaterial. Second, they must be scaffold to the growth of new tissue. Third, they must resist force, because as you can see, the blood is pumped to the heart. And finally, they must avoid premature rupture and bacterial infection. I'm going to show you some of the ineffective solutions that are being suggested to solve this problem. The first one is the nitroglycerin injection. The problem is that this thing is applied not just to repair the tissue, just to stop the expanding damaged tissue. So if a person has a heart attack, you put it and the scar don't grow anymore. And then you have, when the disease is in the final stage, you usually have to replace the ventricle with an implant. So a company named Biotech developed this extracellular matrix, and the only thing is that you put it in the heart and it will heal like this. Okay. This is an example for the open heart surgery. Okay, the matrix that I showed you is used, for example, in a series of 21 class 4 heart failure patients. That means that in the St. Vincent Heart Center of Indiana, the Christopher Salerno make a lot of surgeries and use this biomaterial. The thing is that you don't have to, this biomaterial don't solve the problem, and it's just used to cover the implant. In these surgeries, the doctor implant a device. Okay, so now biomaterials in an injectable form have recently become a vanguard approach to this therapy. The idea is that you inject the biomaterial in the affected region, so you don't have to open the heart. And that will reduce the stresses and stabilize the remodeling of the ventricle. Okay, these biomaterials have been tested in mice, and it was evaluated according to angiogenesis, infarction size, and growth factor content. First, the studies demonstrate that these biomaterials recruit positive cells and help to regenerate the tissue. Second, you can put growth factors in the biomaterial, and the biomaterial can carry out into the heart, and that enhance angiogenesis and contractility. And finally, these studies demonstrate that 31 to 36% improvement in cardiac function after 2 or 6 weeks after the injection. Okay. Now we know that these materials are induce a biological and therapeutic effect where they are injected in the affected region, and its properties are critical for the success of the treatment. And if the people understand the importance of these materials, they can develop more things to help the people to recover after.
Questions?
Has the material been proved in here?
No, this material is just being proved in mice, and they are waiting to prove it in humans because they are waiting to the death rate decrease. Because in this study, they proved the material with 26 mice, and 4 of them died. So they are ready to improve the material so they can test it.